If you're over 60, this could be the most important video you ever watch. Every year, thousands of seniors die suddenly. No signs, no time to react. But here's the shocking part. More than 85% of these deaths happen because of small warnings that were ignored. Most people think serious health problems come with loud, painful symptoms. But in reality, your body whispers first. Then it screams. In this video, we'll reveal the top 10 warnings your body may be giving you right now. These aren't just random signs. These are red alerts your body sends before something major, like a heart attack, stroke, or organ failure. And the scariest part, most of these symptoms are brushed off as normal aging. But they're not. If you've ever felt tired without reason, had sudden dizziness or even mild chest pain, your body might be begging you to take action. So watch until the end, because warning number 1 could be what saves your life or a loved one's. Your future health depends on recognizing these signs before it's too late. Let's begin with the 10th most ignored warning that can suddenly turn deadly. 10. Numbness in face, arm, or leg, especially on one side. One of the most dangerous signs that often gets ignored is sudden numbness or weakness in your face, arm, or leg, especially on one side of your body. Many seniors think it's just a pinched nerve or poor circulation, but it could be much worse. This is actually one of the most common early signs of a stroke. Your brain may be losing blood supply, and every second matters. If you wake up feeling that your face is drooping on one side or you can't lift one arm properly, don't wait or sleep it off. Get emergency help immediately. The longer you wait, the more brain damage you may suffer, and it could even lead to death or lifelong disability. Stroke is one of the top killers among people over 60, and this early warning is your body's last cry for help. Time is brain. Fast treatment can reverse the effects if caught early, but delay could mean the end of your independence or your life. Always remember the FAST method: face drooping, arm weakness, speech difficulty, time to call emergency. If you notice any of these symptoms in yourself or a loved one, act immediately. This is one sign that should never be taken lightly. 9. Sudden vision changes or double vision. Many seniors think blurry or double vision is just a normal part of aging, but if it happens suddenly without warning, you must take it seriously. Sudden vision problems can be a red flag for something dangerous, like a stroke, a blood clot, or even bleeding in the brain. When a stroke affects the part of your brain that controls vision, it can cause sudden blindness, seeing double, or having shadows in your vision. Sometimes these symptoms come and go in just a few minutes, but that doesn't mean you're safe. It could be a warning of a bigger stroke coming soon. Eye issues may also mean problems with blood vessels in the eyes, which is common in diabetes and high blood pressure. If you see flashing lights, floating shapes, or dark areas that weren't there before, go to a doctor or hospital immediately. Never ignore sudden changes in your sight. It's your brain and body begging for help. Acting fast can prevent permanent vision loss or even save your life. Don't blame new glasses or age for a serious sign like this. Sudden vision changes are never normal and should always be treated as a medical emergency, especially if you're over 60. 8. Unexplained fatigue or weakness. Feeling tired once in a while is normal. But if you feel completely drained for no reason, even after a full night's sleep, your body might be trying to warn you. Sudden or extreme fatigue, especially in seniors, can be one of the earliest signs of serious health issues like heart disease, kidney problems, infections, or even cancer. Many seniors think they're just getting older, but there's a big difference between normal aging and dangerous exhaustion. If simple tasks like walking to the kitchen or taking a shower leave you breathless or weak, it's time to get checked. When your heart, liver, or kidneys are not working properly, your body has to work harder, and that leads to crushing fatigue. In some cases, it's even the first symptom of a silent heart attack, especially in women. Also, low blood counts, thyroid problems, and poor nutrition can make you feel constantly tired. Don't ignore this. If you find yourself sleeping more than usual, losing interest in everything, or feeling weak all day, your body is waving a red flag. Get tested. Talk to a doctor. You don't have to accept exhaustion as normal. It might be your body's way of saying something is seriously wrong. 7. Swelling in legs or ankles. Have you noticed your feet or ankles swelling by the end of the day? Do your shoes feel tighter or leave deep marks on your skin? For many seniors, this may seem harmless, but it can be an early sign of something serious. Swelling, especially in both legs, can mean that your heart is struggling to pump blood properly. This condition, called congestive heart failure, causes fluid to build up in your legs, ankles, and even around your lungs. That's why you may also feel breathless at night or when lying flat. In other cases, swollen legs may be caused by kidney or liver problems, both of which affect how your body handles fluid. Sometimes the swelling may be due to blood clots or poor circulation, which can quickly lead to dangerous complications if left untreated. If you press on your ankle and your finger leaves a dent, or if your swelling is painful or comes with shortness of breath, do not wait. Get medical help immediately. Don't assume it's just salt or age. Constant or sudden swelling is never normal. Your legs might be the first place where your heart or kidneys show trouble. Listen to the warning before it's too late. 6. Irregular heartbeat or pounding pulse. Do you sometimes feel like your heart skips a beat, races too fast, or pounds suddenly without warning? Many seniors experience this and think it's just stress or age. But in reality, an irregular heartbeat, also called arrhythmia, can be very dangerous. One common type is called atrial fibrillation. It causes your heart to beat out of rhythm, which can lead to blood clots, stroke, or even sudden death if untreated. You may feel fluttering in your chest, dizziness, shortness of breath, or feel like you're going to faint. Some people feel nothing at all. That's what makes it even more dangerous. If your heart isn't beating normally, it can't pump blood properly to your brain and body. This increases your risk of stroke 5 times. Seniors with diabetes, high blood pressure, or sleep apnea are especially at risk. If you ever notice your heart pounding for no reason or skipping in a strange way, don't ignore it. Use a smartwatch or blood pressure monitor to check your pulse. If it's too fast, too slow, or uneven, see your doctor right away. Early treatment can prevent clots and strokes. Your heartbeat is your life rhythm. When it changes, pay attention. 5. Sudden confusion or memory loss. Forgetfulness happens with age, but sudden confusion, trouble speaking, or forgetting where you are isn't just aging, it's a medical emergency. If a senior suddenly acts confused, repeats questions nonstop, struggles to find words, or gets lost in familiar places, it could mean something serious like a stroke, brain infection, or blood sugar emergency. In some cases, it could even be the first sign of dementia or Alzheimer's. But when it happens quickly, within hours or a day, think stroke or infection. For example, urinary tract infections, UTIs, in seniors often don't cause pain, they cause confusion. Also, low oxygen levels from heart or lung issues can make the brain foggy. If you or a loved one show sudden mental changes, don't wait. It's not just tired or just age. It could mean the brain isn't getting enough blood or oxygen, or it's reacting to a hidden illness. Call a doctor immediately. If it's a stroke, early treatment can prevent major brain damage. If it's a UTI or blood sugar issue, fast treatment can bring the mind back quickly. Confusion is your brain's emergency alarm. Never ignore it, especially if it comes on suddenly or gets worse fast. And before we move to warning number 4, here's something exciting. We're launching our brand new senior health app in just a few days, designed especially for people over 60. It includes smart health calculators, daily routines for brain, heart, and joint support, emergency checklists, and even a simple tracker for water, steps, and medicines. Everything is made with large fonts and easy buttons, so it's senior-friendly and stress-free to use. The download link will be added soon in the video description and pinned comment, so stay tuned. This might become the most helpful app on your phone. 4. Severe headache with no known cause. A headache might not seem dangerous, but if it's sudden, sharp, or worse than anything you felt before, it could be deadly. Seniors who get a severe headache out of nowhere must take it seriously. This kind of pain can be a sign of bleeding in the brain, a brain aneurysm, high blood pressure crisis, or even a stroke. If the headache comes with nausea, vision problems, trouble speaking, or confusion, go to the emergency room immediately. Don't try to sleep it off. Time is critical. Also, if you have a headache after falling or hitting your head, even slightly, it could mean a brain bleed that shows up hours later. Painkillers may hide the problem, but they don't fix it. And if you're on blood thinners, your risk is even higher. Headaches that wake you up from sleep, don't go away with medicine, or feel different from normal should never be ignored. Your brain is a delicate organ, and a sudden, unexplained headache is often the first cry for help. Don't guess, get tested. It's better to find nothing than to miss something fatal. This kind of headache is never just a headache. It could be your brain warning you to act fast. 3. Dizziness or sudden loss of balance. If you suddenly feel dizzy, lightheaded, or like the room is spinning, don't just sit down and wait for it to pass. Dizziness is one of the most overlooked early signs of serious problems in seniors. It could mean low blood pressure, poor blood flow to the brain, irregular heartbeat, inner ear issues, or even a warning stroke. Loss of balance is especially dangerous because it increases the risk of falls, which are a leading cause of injury and death in people over 60. Sometimes dizziness happens when you stand up too quickly. But if it happens often, or if you feel faint, off balance, or close to blacking out, your heart may not be pumping enough blood to your brain. Dehydration, medication side effects, or low blood sugar can also cause it. But that's not something to guess about. Seniors must treat dizziness as an emergency, not an annoyance. If it comes with chest pain, trouble walking, or slurred speech, call for help immediately. You might be just minutes away from a bigger event like a stroke. Balance isn't just about walking straight. It's a sign your brain and body are in sync. When it's off, act fast. 2. Unusual shortness of breath. Do you ever feel like you can't catch your breath after climbing stairs or even while sitting still? That's not just aging, that's a warning sign. Shortness of breath in seniors is often related to heart failure, lung disease, fluid in the lungs, or even silent heart attacks. Some people experience it only at night or when lying flat. That's called orthopnea, and it usually means fluid is building up because the heart isn't pumping properly. Other times, shortness of breath comes with coughing, wheezing, or swelling in the legs. This could mean your lungs or heart are in danger. Seniors with these symptoms often think they're just out of shape, but they could be moments away from collapse. If you ever feel breathless doing something easy or worse, while resting, don't wait. Call your doctor or visit a hospital. This symptom often shows up days or weeks before a major health event. Don't blame it on age, weather, or weight. Your body is trying to breathe. If you can't catch your breath, your organs can't either. Get checked before it's too late. Breath is life. When it becomes difficult, it's time to act fast and save your future. 1. Sudden chest tightness or discomfort. The number one warning most seniors ignore before a sudden heart attack is chest discomfort. It's not always pain. It could feel like pressure, squeezing, fullness, or tightness in the center of your chest. Some say it feels like an elephant sitting on their chest. Others feel it in the shoulders, neck, jaw, or arms, especially the left one. Many people ignore it, thinking it's gas, heartburn, or muscle strain. But this simple warning could be your final one. A heart attack can happen quietly, and seniors often don't feel it like younger people do. Instead of sharp pain, they might just feel tired, sweaty, or nauseated. That's why it's so deadly. It sneaks up silently. If you ever feel chest pressure that lasts more than a few minutes or goes away and comes back, call emergency services immediately. Don't drive yourself. Don't wait. Fast treatment saves lives. Every second matters. If you've had high blood pressure, diabetes, or a history of heart disease, this warning is even more serious. Your heart is the engine of your body. When it sends a signal, even a small one, listen. It might be your only chance to stop a fatal heart attack. Now, you've seen the 10 most ignored warnings that could lead to sudden death in seniors. These signs may seem small, but they're your body's way of crying out for help before something serious happens. Don't wait until it's too late. Whether it's chest pressure, confusion, swelling, or sudden fatigue, always listen to what your body is telling you. It's never just aging. It could be a silent alarm for your heart, brain, or other vital organs. If you found even one symptom on this list familiar, don't panic, but don't ignore it either. Talk to your doctor. Get checked. Taking action now could save your life or the life of someone you love. And remember, we're launching our senior health app in just a few days. It's designed to help you track symptoms, stay healthy, and avoid future emergencies. The link will be in the description and pinned comment very soon. Stay alert, stay safe, and most importantly, stay alive. If this video helped you, please share it with your friends and family. You might just save a life today.